What has been your experience with patient follow-ups and the effectiveness of medical cannabis treatment on patients that are currently in the program?
Follow-up has been really, really good because, one, when you follow up, you kind of see how that patient does from the aspect of, okay, are they getting better? And then sometimes you also have those other occurrences where maybe that's a terminal piece to it anyway, and they're maybe on chemotherapy and having nausea or so forth, or you may not see that other end of it. There's a twofold street to that, but majority of it though, the follow-ups are extremely, extremely helpful because not only do you get to individualize it with the patient, but you find out what's working, what's not working, who's winning, who's not winning, who's doing a good job as bud tenders with these patients, who's taking care of these patients, who's actually tailoring it back to the patient. So that's really, really important because that patient wants to have a good relationship with them because that's just as important as me. I promise you at the end of it.
Absolutely.
And the follow-up piece also gives you a lot of information and data of what everybody's kind of using for different things at different times because I have some of them they'll journal and they'll come in like 10 pages deep and stuff. Sure. Then I have some that this is all they use and that's all they're looking for. Maybe they may be grown differently with a different brand and may have a different effect, and so you have to kind of go back in there. But right now, 3 years in, most of them have kind of tuned themselves in pretty good at this point and fine-tuned exactly what they're after. So every now and then we'll see somebody hadn't, gone in after what they're after. But overall, the follow-ups are extremely, extremely important. And we make sure those are scheduled. We also call them, let them know. That way at least all in the same page.
Absolutely. This is my last question, and I was just going to have each of you guys give an answer to it. We'll just go down the line. How can Mississippi's medical cannabis program be improved? If you could think of one thing that could be changed or improved with our current program, what would it be, and how would it affect access or improve the program?
Oh, please don't start with me with that question. Come on, I'm
Well,
the
we can start
one
on the other
person
end.
here who's been a
I
regulator.
figured you would just say research.
I mean, yeah, research. That's my answer.
Justin, how about you?
I think keeping along what we've done, I think we've done more than any other state in the union that allows medical cannabis to be used. So I love the different facets of our program and the research that we've been doing, and the studies that we have. I mean, it's Schedule 1 substance still. Okay, so that's why the research hasn't been well done as of yet, and so that we're making strides in the area of research. We're able to, you talked about individualization, which is important for patients, but also standardization is important for prescribers as well, because for example, I'm doing a systematic review on the peripheral neuropathy parameter that we're using in Mississippi. We're actually one of 9 states that uses peripheral neuropathy specifically for diabetes patients, among the states that offer medical cannabis. So anybody in here have peripheral neuropathy from diabetes? Nobody wants to raise their hand. Son? Your friend's son?
Her
Your
grandson. Oh, wow. No, I was going to say he must be young.
Yeah.
Not
Wow.
diabetes, but car wrecks.
Ah, okay. So one of the things that I looked at, of course, with NCCRE was about peripheral neuropathy, and I wanted to look at, now for pain management, there's a lot of studies out there that show specifically that pain management can be improved by using medical cannabis. But what I wanted to look at was peripheral neuropathy, because the presentation for peripheral neuropathy for people with diabetes is different than other conditions that they might have, such as in a car wreck and things like that. Turns out that there's 4 studies, but those 4 studies are randomized controlled trials. They're the highest level of evidence, and they were really well conducted, and conducted to the point that there were specifics among those studies that it showed that patients that took 18 to 20 milligrams a day, those were the ones that were helped from peripheral neuropathy with medical cannabis. So anyway, I'm saying that because the standardization, physicians want to know doses that are, effective. So we've got effective doses for all medications, approved by the FDA. What we need are medical cannabis and doses of medical cannabis that are effective for certain conditions. And so those studies hopefully are going to ferret those things out in the future.
Sure.
Put me down for that answer also.
Yeah, that's a great answer.
Research. She said research.
Research.
Diesel, in your opinion, if there was one thing that you could, with a magic wand, if you could change it overnight.
Oh no.
Everybody knows how I feel about the intoxicating hemp industry, but I'll give a different answer. If I could change one thing, I would stop thinking that our patients and practitioners need a list of conditions. When I go see my doctor, if I tell him I have anything going wrong, we get to discuss what it is. We get to choose which medicine we'll use. But with cannabis, it has to be on this list. I say there shouldn't be a list. I say that doctors and their patients should make a decision if cannabis is right for them with whatever condition they have. So that's what I would change.
Great answer.
Thank you. Somebody liked it. Appreciate that.
And that is an indication for some of the states, not Mississippi.
Yeah, not
unfortunately.
Mississippi,
Yeah, I
but there
know.
are states
I
where
know.
it's somewhat doctor.
Yeah, that's
Yeah,
what
I'm
I'd
not
like
sure
to
if it's-
change
That's gonna
here.
happen here in Mississippi. It's a want to have. I don't know if it'll
Right.
it'll actually.
I'll get it
happen.
done.
Yeah.
I'm here for the
If you
long
did a
haul.
magic wand.
We'll get it done.
Yes, absolutely. Tatum, in your opinion,
I think it's to shed some of these negative connotations and the propaganda-ish component of the opinion or the general reception of the cannabis program. Make educational events like this more commonplace and more ready, and then drive acceptance. You know, some people take Tylenol, some people take Advil, some people won't take those at all. All of that is perfectly acceptable, and no judgments are passed because you're one or the other or neither. Well, cannabis isn't like that. And the sooner we get to that point where, oh, they do it and that doesn't matter, or they don't and that doesn't matter, the better this program is going to be.
sure,
I agree.
absolutely. David,
I would say, that's a tough question, but at this point, you know, one, the main thing would look to be allowing people to see the benefits of it through feedback somehow, because if we're all human and we see somebody who does really well with it, therefore we want that same outcome. One way to do that is to actually see that, and the majority of the times that may be through testimonials, whether they did good or bad. So you're going to have people on both sides of the aisle with
yeah,
that.
absolutely.
Second thing to that is making sure that the standards stay high, because if you want a good research program, the standards need to stay high to who has the certifications and who has the cards and why we're doing it. So from state across. And then the third thing I would look at would be, you know, okay, now we have research, we're backing these up, continue down and look at those diagnoses that maybe have limited it, and maybe going back in and look at anxiety, depression, insomnia. Because I think you'll see there's a layover to a lot of these other things in there, because it's not just one piece of this. Health is encompassing, it's not just one thing. So that would be my big pieces. But main thing at this point, allowing a little more propaganda to come out and show the world, hey, this ain't really what you think it is. So
I think, yeah, you're right. I
changing-
mean,
and changing
telling
that
positive
mindset.
patient outcome stories is extremely important. And I think we have somebody in the audience here that works on that
The
pretty
same patient voice is in
diligently.
there, yes.
So, yeah, I agree with you. I think, you know, telling those patient stories and sharing the success stories of medical cannabis is super important. And, you know, will
Absolutely.
help reduce some of the stigma that surround patients. So, well, that's it for my questions. I guess we'll open it up for audience. And, yeah, if you just want to raise your hand and I'll point at you. Shauna, yes.
Okay, I have a question about the research. Are you guys partnering with local cultivators so it's strain specific from the same grower, grown the same way, the same strain every time? Or does the university have their own cultivation program for the research?
So that's a great question. So basically kind of what she asked is, when we're talking about these patients involved in these research studies, where is the cannabis coming from? Are we growing at University of Mississippi? Because everybody has heard, you know, there's been research happening at UM since the 60s on cannabis plants, or is it coming from the industry, from the cannabis industry here? And the answer to that is none of the product that's grown at the University of Mississippi is actually part of the Mississippi Medical Cannabis Program. The cannabis grown there is grown under a NIDA, National Institute of Drug Abuse contract. So all of that cannabis is completely separate from the program. It doesn't go to our patients. It goes to wherever NIDA disseminates it It's grown under very specific conditions and in small batches. We're talking like 200 pre-rolls a year. So very, very small. So all of the cannabis that's going to be utilized for the patients in our studies is going to be from the Mississippi Medical Cannabis Program cultivators and dispensaries. So it will be from the industry.
So when you do it, will that patient only be allowed to smoke that one strain from that one cultivator for
No.
a certain period of time?
So, you know, there's going to be different studies that happen. Our first study, the one that we are actually going to be starting now, we won't be controlling the type of cannabis being used nor the strain. It will be a self-reported thing. So a patient's going to be able to use whatever products that they want to utilize. Yeah.
My question is twofold, really, and it starts with Dr. David. I feel like cannabis can help me. Where do I go from there? I call you, we set up a consultation. What do I need to bring? What does that consultation look like? Set those expectations. And then the second part of that is Diesel, Tatum, you know, you're on the dispensary side, Dr. David, when you send that patient away, what happens then, and what do I expect then?
So, good question. So, our expectations are pretty much laid out. We got a standardization to this. When they call or whether they come in or whatever that is, we get you to go through our portal online. Most websites that way, because one, it intakes, we get you information, allows us to get the ability and consent to go and look and talk to you. From there, we can contact, one of our office staff will contact you. Hey, how's it going? Mr. Joe, doing all right? We're here, we see you signed up. All right, so what you got going? Well, I got this and I got this. All right, who's been treating that? Well, such and such has been treating it. Okay, we're gonna need those medical records, so we facilitate that, whether that be through electronic, already having access to it through some of the electronic systems, or via fax of that patient and looking at those medical records and getting whatever time period we need. Once we have that back, we then call, schedule you. Of course, we've reviewed it before you even get there. That way there's no expectations of walking in that door that something's not going to go right or this ain't going to work and they're going to be leaving unhappy. We don't want that. And then we sit them down. Our usual mojo, once you get in office, we'll go over records, we do vital signs, we come back at it. While I look through the chart, you know, and then we have a conversation. And a lot of times it's an open conversation, and then I probably go in depth, probably too much, because I go A to B to C, talk about left, talk about the effects, talk about the risks and benefits. Then we go back to the right, talk about the potential good, the potential bad, just to make sure the expectations are there. That way nobody's out in the field. Then we go, by that time they're already kind of like deer in headlights, and I'm just kidding. But then we work and we facilitate to not only get that done, we help them online to get everything done and completed, submitted. And then we also tell them, hey, look, this ain't coming to your mailbox, this is coming to your email. Can't tell you how many of them come back that are older that may not be able to do email or have the ability to print that or want it laminated or whatever it is. So they have a home, because I mean, about once a day, one stops in for something, whether it be for the patient update or my card's going out or I got an email and I'm panicking, so forth. And then you have a home, you know what you got, you're completed all the way to the end. You already have the expectation set as well that your appointment's set in 6 months. We're gonna notify you. We're gonna let you know what's coming at you via text message. And then you're gonna follow up and so forth and see how everything's going. You know, and it's laid out pretty smooth, because when you get there, one, you're usually in a panic. I don't know these guys, oh my gosh, usually I cut a joke or two, ease the air, then everybody kind of lightens back down. And depending on the situations, sometimes I wind up with 3 or 4 people in the office in there, so that's always a good interesting run. But we try to answer everything as much as we can. Now, from the dispensary side, you can go to any of them you want, we tell them that. So that's the piece that's in place. Most of them usually at this point know, well, I know such and such is on the corner over there, Bob goes here, vice versa. So they have the ability to go to that. Educational wise, there are some videos and some different things we use to help to that, depending on where they're at. Most of the time at this point, though, you see most of them that are using for a little bit. And, you know, dispensary wise, I preach that this is not just one piece. You may end up changing. This may change. This dispensary may have this. You may have to find this. This over here may be grown with one dispensary brand, and then you may be having to look somewhere else to get it. So knowing that, well, after a couple months it's not working, you may have to change out. So your bud tenders are really, really important, and developing a relationship with them is one of the best things that you can do. Going back and forth, hey, this worked, this didn't work, this worked, this didn't work. So they have some place to call home. And the majority of them do very, very well. And like I said, so we're not big volume, so that's one of the things that makes it a little bit easier. But that's your process in Mississippi. Some places, on other places, intake online, majority of them do. We house the records and keep up with them, and doesn't go anywhere. As I tell them, I said it's all in the wonderful cloud. But because that's always a question that everybody has: was anybody gonna see this? I'm like, it does go in your Mississippi PNP, so we want you to know that whoever's prescribing some of these other controlled substances, you need to be on the same page with them. And I explain that to them very, very upfront, because they need to know. That way you don't walk in and get booted off of whatever medication that you're on. That way everybody's on the same field. And that usually, one, you don't want to do that anyway, but two, there's a lot happier outcomes out of that, because those other providers don't want that as well. So they have to be on board. So I always tell them up front, make sure you talk to your other providers before you get down that road. Yeah, that's a long answer, sorry.
You're good.
Right.
And I just tell you, Diesel, once you send them away, Dr. David, what can you expect once you walk into a dispensary?
I mean, with us, it's Southern hospitality. We want you to come in, feel warm, welcome, and part of our family. We want you to leave full of knowledge, maybe not food this time, but we want you to have the product that you came for, get the results that you're after, and know why you've chosen that, or why that is the choice. So yeah, that's my take on that. Just to feel comfortable, to not have the fear, to not have the nerves, and to not be overwhelmed. We try to counter that with good old Southern hospitality.
I think
it's safe to say that you're an expert on most of the products in your dispensaries, right? So if a patient comes in and they don't know what they need, they're a first-time patient, you as a bud tender or a wellness advisor are their best person to speak to, because you can help navigate, maybe you want to try this first, or these types of products, these lines of products.
Right. And that ties into feedback. When you come into a dispensary, be specific with our bud tenders. If they don't know or experience the exact problem that you're working with, then they've spoken with someone or a multitude of people that do have that common characteristic or that common ailment. And the feedback is where they gather that knowledge. So, part of that process is ask the bud tender, if you have fibromyalgia, what are people with fibromyalgia telling you? What are they telling you works for them? And don't be afraid to try more than one thing, just
Do
like
you
we were.
document that? Do your bud tenders document that?
You have a profile at Root Down, so when you come in any of our stores, your profile travels with you, and everything that you do at our store is documented in your profile, and our bud tenders can go back and access that. A lot of people,
Store to store?
every store, your profile stays the same. It travels with you.
Also, I wanted to add this, don't tell the Department of Health I said this because Laura will kill me. As a patient, you are entitled to a list of products that you've purchased. So if a patient ever really needs to know, okay, I need to look back on what I bought, you can contact the Department of Health and ask for a printout of the products that you previously bought. Comprehensive for all the dispensaries. Don't tell them I said that though.
And we also help troubleshoot with anything with the state, whether it be simply as a name that's wrong, or a one-day expiration, or something in between. There's stuff happens. So we usually facilitate that and try to help as much as we can, to at least get you to the right places to get it fixed in a timely manner. Because I don't want to get yelled at because you can't go to the dispensary. So,
I'm sorry I abandoned you.
no, we do good with it. Most of the time we're pretty on point with that. Thank God for Dustin, my nurse. So